President Trump's handlers are concerned about his health and cognitive decline. What isn't so obvious is why they continue to support the fiction cast to hide this.
They have Jasmine Crockett, a low IQ person. They have AOC's low IQ. You give her an IQ test, have her pass like the exams that I decided to take. Let AOC go against Trump. Let Jasmine go against Trump. I don't think Jasmine, the first couple of questions are easy. A tiger, an elephant, a giraffe, you know. When you get up to about 5 or 6, and then when you get up to 10 and 20 and 25, they couldn't come close to answering any of those questions.
Quiet.
What part of your body was the MRI looking at?
I have no idea. It was just an MRI. What part of the body? It wasn't the brain because I took a cognitive test and I aced it. I got a perfect mark, which you would be incapable of doing. Goodbye, everybody.
Thank you
too.
Mr. President.
Thank you, Mr. President.
Thank you, sir.
So I'm not one to get involved in politics or mix politics with clinical. I certainly have my political views, and those who know me know where I stand on various issues, but that's not important. And likewise, the commentary today is not about politics, not directly. It is, in a sense, about leadership and the role that mental health plays in leadership and what we should be willing to tolerate. Now, specifically, there's been a lot of discussion of late around President Trump's cognitive state, and with many observers noting that his claim of having aced an IQ test for the third time is more than a little deceiving. Furthermore, his behavior shows multiple indications of a need for ongoing medical and psychiatric monitoring, if not treatment. To make matters worse, he has threatened charges of sedition against those who question his health status, despite obvious signs of trouble. As a Canadian, I have seen the impact of his policies, and indeed, things are so dire between Canada and the US that our Prime Minister, Mark Carney, has recently concluded that we must move forward without the US and develop multiple international trade partners to make up for the gaps that have been created by President Trump's policies. Having spent some time studying psychometrics and administering a variety of tests in education and in clinical optometry, it struck me the President's claims about the cognitive test he decided to take was a worthy topic to review. In particular, why and when would we or should we administer psychometric batteries and tests? The President's behavior can be ascribed in part to fatigue, but there are frank behavioral signs and physical signs that are suggestive of a number of relatively common psychiatric disorders. And these include memory infacility and loss, meandering, incoherent speech, cruel and mean-spirited responses, belittling behavior, especially towards women and especially towards people of color. There's a compulsive need to distort facts. There's a chronic self-aggrandizement and chronic and reflexive mendacity. The fact that he has had multiple MRIs and taken the MoCA 3 times already speaks loudly to clinicians in the know. As an optometrist working clinically, working with behavioral cases, a variety of conditions come my way. I'm not an expert in this area, but if I'm picking these things up, surely there is something going on here. Let's just take a few minutes to look at the MoCA itself, or the latest version of it. And then we'll have a more detailed look at what constitutes an actual intelligence test, an IQ test. So the MoCA, or the Montreal Cognitive Assessment, currently in version 8.3, was designed for healthcare professionals and researchers to detect cognitive impairment related to the following conditions. Note these are psychiatric medical conditions that impact on cognition. Now let's just be clear. Implementing the MoCA is not a test of intelligence. It's not something we do voluntarily. It's a test recommended by medical professionals to detect impairment and decline. We're talking about cases of Alzheimer's disease, Parkinson's disease, Huntington's, Lewy body dementia, VCI or stroke, frontotemporal dementia, brain metastasis, ALS, sleep behavior disorders, brain tumors, multiple sclerosis, head trauma, depression, schizophrenia, heart failure, substance abuse, HIV, COVID, and other medical concerns. Now, in the MoCA, there are 8 distinct parts of the test: visual spatial executive, naming, memory, attention, language, abstraction, delayed recall, and orientation. Let's have a look at this test very quickly here. To begin with, in the visual spatial portion, we see that we have to join number 1 with A, number 2 with B, 3 with C, 4 with D, and so on. In the second section, we take a basic bed, a stick bed, and we have to copy it. And then finally, we have to draw a clock, 5 past 10. So we're looking at contour, numbers, and hands. These should all be present. It's a basic clock drawing. Notice that each component here is assessed based on points, and I'll get into the scoring a little bit later. Next, we have to name animals. I mean, again, it's a very low-level recall element here, but horse, tiger, duck, pretty basic memory here. And then here, we read a list of words. Here they are: leg, cotton, school, tomato, and white. And we read it a couple of times, and then we do a recall after 5 minutes. How many of these words did you remember after 5 minutes? You're allowed to practice them twice. Here we read, in attention, we read a list of digits, and we have to repeat them in the forward order, and then we have to repeat them in the backward order in this case. So 5 digits in forward, 3 digits in reverse. Here again, in the attention section, we're asking the subject to tap his hand at each instance of the letter A. And to finalize the attention section, we start at the number 60 and we do a serial subtraction of 7. So 53, 46, 39, and so forth. In the language section, we are asking to repeat a sentence, and then there's another sentence to repeat. Finally, for language, we're looking for fluency. Name the maximum number of words in 1 minute that begin with the letter B. Abstraction, we're looking at similarity between an orange and a banana, hammer and a screwdriver, matches and a lamp. Delayed recall, again, we're returning to our memory element of earlier. And we finish up orientation, where the subject is asked to identify the date, month, year, the day, and the place, and the city where they are. Since the MoCA is a medical screening test, it is designed around repeatability and efficiency. The test typically takes about 10 minutes, or anywhere from 8 to 15. The test is scored out of a total of 30 points. A score of 26 or above is considered normal. And so we'll stop here just for a moment and we'll review some basic observations. There would be no reason to take an IQ test twice or 3 times in just a few years. Clearly, the test administered was the MoCA, designed to detect cognitive loss where there is a perceived risk. Repeating the test 3 times underlines ongoing risk. Cognitive decline is not known to reverse course, but rather to worsen in time, since it is organic, progressive with age. President Trump said, "Have her pass the exam I decided to take." People are generally not aware of psychometric tools and for what purposes they are implemented. Trump equates the MoCA to an IQ test that he aced. This is a telling comment. He would not have asked for it, as he says, but rather it would have been recommended for one of the reasons given above. He would have agreed to take the test implicitly by doing it as a condition of staying in office. I have to question also the mental state of somebody who's bragging about taking a cognitive test repeatedly. Trump never actually names the test, but somewhat accurately describes it as an aptitude test. The MoCA assesses very basic cognitive skills. Acing the test in this case simply means that he met the minimum standard for non-cognitive decline, or at least 26 out of 30. Representing this as an IQ test belies his deep lack of knowledge. Continuing to do so after 7 years is pathological. It's lying. He challenges others as being of low IQ, even as his own cognitive decline becomes more apparent. People around him must be aware of the level of risk in outward signs. Listening to President Trump speak, my ears hear fatigue and confusion, a reliance on tropes and reflex. Politics comes with lying, as we've learned, but the extreme polarity in his own positions gives pause. This combined with age, lifestyle including poor diet, outward signs such as peripheral swelling, signs of hemorrhaging in his hands, often a sign of ongoing use of blood thinners, and a recent MRI, not his first, they all suggest risk of diffuse cerebral involvement. Clinically, the discussion is straightforward. President Trump's handlers are concerned about his health and cognitive decline. What isn't so obvious is why they continue to support the fiction cast to hide this. Now let's take a few minutes and look at an actual IQ test so you can compare. So when it comes to IQ, or common measures of intelligence in adults, there are legitimate reasons why these would typically be undertaken. Take the WAIS, for example, the Wechsler Adult Intelligence Scale. Most often administered for a variety of clinical, education, and occupational and research purposes. The test will take between 1 and 3 hours, depending on client status and the number of indexes administered. What would be of interest is to see President Trump get his wish, to actually compete on an open stage in writing the WAIS. Let's have a look at it. Below are the most common reasons why people might take the WAIS. For the record, most administrations will be voluntary, contrasted with the MoCA, which will be given for medical diagnostic reasons. Number 1, for clinical assessment. The WAIS can be used to evaluate cognitive function in mental health and neurological contexts. You're looking at neurological evaluation to assess the effects of brain injury, stroke, dementia, or other neurological conditions on cognitive performance. For psychiatric assessment, it helps to differentiate between cognitive deficits due to mental illness, like schizophrenia, depression, versus neurological causes. In learning or intellectual disabilities, the WAIS helps to determine whether an individual meets criteria for intellectual disability, ID, or has specific learning disorders when compared with achievement tests. Certainly, the WAIS is used to consider cognitive decline. It detects changes in functioning due to aging, dementia, or neurodegenerative diseases such as Alzheimer's. The WAIS is frequently used in education and vocational assessment. It's used to guide academic or occupational planning. For educational placement, to assess intellectual strengths and weaknesses that might affect learning or academic performance in adults or older adolescents. For career or vocational evaluation, the WAIS provides information about intellectual potential and problem-solving style, useful in rehabilitation or career counseling. In forensic and legal contexts, the WAIS is used to assess competency or criminal responsibility when it comes to trial. It's used to determine eligibility for disability benefits or accommodations. It is used in sentencing and mitigation evaluations. The WAIS is used in research and psychological studies. The WAIS is used to measure intelligence as a variable in cognitive, developmental, or personality research, studies of neurological or psychiatric populations, and validation of other psychological or educational tests. The WAIS is used in baseline or comparative testing, used to establish a cognitive baseline before surgery, injury, or treatment, for example, chemotherapy, head trauma recovery. It's also used to compare pre- and post-intervention performance to track changes in cognition and to assess efficacy of trials. Now let's consider what an IQ test looks like before comparing it to the MoCA. The WAIS is one of the most widely used tests for measuring adult intelligence. It assesses several aspects of cognitive function across multiple domains, or testing axes, and produces both index scores and an overall full-scale IQ, or FSIQ. Here's a summary. So the main testing axes, or indexes. The WAIS measures intelligence through 4 major index scores, each representing a key area of cognitive ability. Number 1, Verbal Comprehension Index, or VCI. Measures include understanding, reasoning, and expressing verbal concepts. Subtests include similarities, vocabulary, and information. Number 2, PRI, Perceptual Reasoning Index. The measures include nonverbal and spatial reasoning, visual motor integration. Subtests include block design, matrix reasoning, and visual puzzles. Axis, or index number 3, is the Working Memory Index, WMI. Measures include attention, concentration, and mental manipulation of information. Subtests include digit span, arithmetic, and Axis 4, Processing Speed Index, or PSI, Measures include speed and accuracy of visual identification, decision-making, and eye-hand coordination. Subtests include symbol search and coding. After assessing the 4 axes, we can derive 2 indices, or 2 indexes. Number 1 is the full-scale IQ, which is FSIQ. It's the overall measure of general intellectual ability, and it's derived from all 4 index scores. And then there's the General Ability Index, GAI, which is an optional composite score emphasizing reasoning ability from VCI and PRI, while minimizing the effects of working memory and processing speed. In terms of scoring, raw scores are converted to scaled scores, meaning the mean of 10 and a standard deviation of 3. Index and IQ scores derived from the scaled scores and standardized with a mean of 100, standard deviation of 10. Now, the bottom line is when you compare the two, the MoCA versus the WAIS, which is a full-scale IQ score, you can see very quickly that these are different tests designed for different reasons. That in the case of the MoCA, it's quick, it's diagnostic, it's medically diagnostic. These are given to people who give the appearance of needing it. Now, you can think of relatives, older relatives that you might have who also show signs of cognitive loss. And in many of these cases, some of you are going to know people who have had to take the MoCA for different reasons. In clinic, certainly that comes up as well. Let's have a look again at video statements and text statements made by President Trump. And perhaps now that you know a little bit more about the testing, you'll have a bit of a different perspective on it. And then at the same time, I'll provide some comment as we go through.
Jasmine Crockett, a low IQ person. They have AOC's low IQ. You give her an IQ test, have her pass like...
So, once again, he's being deceitful. He did not take an IQ test.
Exams that I decided to take. Let AOC...
The exams that I decided to take. You can think about that for a minute. Again, it's like deciding to take a blood test when your doctor wants to probe diabetic status. Yeah, I decided to take it.
Go against Trump. Let Jasmine go against Trump. I don't think Jasmine... The first couple of questions are easy. A tiger, an elephant, a giraffe.
Okay, so he's obviously referring to a different test or a different version of the test, but it's the same test. We had an updated copy of the exam of the test, and it has different animals. I'll note, just rhetorically, identifying an animal is not a question.
You know, when you get up to about 5 or 6, and then when you get up to 10 and 20 and 25, they couldn't come close to answering any of those.
So he's clearly talking about the MoCA, but he's not understanding or not clearly representing how it's scored.
If there's nothing incriminating in the file, sir, why not using as a...
So we're missing context here. I find it difficult to accept that the leader of any nation would be so derisive, so mean-spirited towards women, towards reporters, as to shut them down, not even address the question, just to belittle them with a schoolyard bullying tactic of name-calling. I'm smiling, but at the same time, it's painful to watch.
What part of your body was the MRI looking at?
I have no idea. It was just an MRI. What part of the body? It wasn't the brain because I took a cognitive test.
So he had an MRI, not his first, in recent years, and he has no idea what part of the body they were scanning or why. So this is either he's absolutely lying about it, or it's a sign of serious cognitive decline. He was in the machine for quite some time. An MRI is typically 15 minutes, something like that, but they had no idea, he has no idea why he was in it, even though it was a repeat MRI assessment. And then he concludes that it wasn't his brain, going back to the MoCA test, so he seemed to have aced the MoCA, so they couldn't possibly be scanning his brain. Of course, you know, the logic doesn't follow there. But it does follow that he's, again, being very deceitful. They could well have scanned his brain, but he's just not going to tell us.
And I aced it. I got a perfect mark, which you would be incapable of doing. Goodbye, everybody.
Thank you,
too.
Mr. President.
Thank you, Mr. President.
Sir.
So I'm just going to let this play to show the reporter's face. I feel for this person. Again, the bullying tactics. It's like, I don't want to answer your question, so I'm going to put you down. There's something wrong here. And I think it goes beyond a social construct, just the guy's an asshole. I think there's more to it than that. And based on the testing and the signs on his hands, the swelling that we see, there's things going on here. Any doctor would be able to surmise, probably within reason, appropriate diagnostics here. So I'm just going to leave this here. This is something that was tweeted out, rather truthed out on the 9th of December here. And I'll just go here. There has never been a president that has worked as hard as me. My hours are the longest. My results are among the best. I've stopped 8 wars, saving millions of lives in the process, created the greatest economy in the history of our country, brought business back to the United States at levels never before seen, rebuilt our military, created the largest tax cuts and regulation cuts ever. I mean, I'm not going to argue politics here, but this isn't all good stuff. Closed our open and very dangerous southern border when previous administrations were unable to do so, and created an aura around the United States of America that has led every country in the world to respect us more than ever before. Well, as a Canadian, again, I'm going to question that conclusion. Let's continue. What comes next is really the more interesting part. So in addition to all of that, I go out of my way to do long, thorough, and very boring medical examinations at the great Walter Reed National Military Medical Center, seen and supervised by top doctors, all of whom have given me perfect marks. Some have even said that they have never seen such strong results. They have likely never had to administer the MoCA on any presidents before, maybe Biden, but 3 times in pretty much as many years is something to question here. I do these tests. I'm not told to do them. I decide to do them because I owe it to our country. In addition to the medical, I have done something that no other president has done on 3 separate occasions, he admits it. One being recently by taking what is known as a cognitive examination. Something which few people would be able to do very well on, including those working at the New York Times, and I aced all 3 of them in front of large numbers of doctors and experts, most of whom I don't know. So again, this begs the question, why are we doing the test? Why are we repeating the tests? And what are the actual results? I have been told that few people have been able to ace this examination, and in fact, most do very poorly. Why do they do very poorly? Because doctors are administering the MoCA to people who are in decline. And so yes, they tend to do poorly. Trump is in this group of patients. Despite all of this, before I continue, I'm just noticing here that, which is why many other presidents have decided not to take it at all. Correct. There was no reason for presidents to take the exam before this, and so they didn't have to decide to take it. The New York Times and some others like to pretend that I'm slowing up and maybe not as sharp as I once was, or I'm in poor physical health, knowing that it is not true, knowing that I work very hard, probably harder than I have ever worked before. I will know when I am slowing up, but it's not now. After all the work I've done with the medical exams, cognitive exams, and everything else, I actually believe it's seditious, perhaps even treasonous, for the New York Times and others, I guess myself included, to be consistently doing fake reports in order to libel and demean the President of the United States. I should say, I'm Canadian. Come and get me. And to conclude this very long truth, the New York Times and others, again, like myself, commentators, are the true enemies of the people, and we should do something about it. They have inaccurately reported on all my election results and, in fact, were forced to apologize on much of what they wrote at the New York Times. And this is, again, a misrepresentation of the court case. The best thing that could happen to this country would be if the New York Times would cease publication because they are a horrible, biased, untruthful source of information. Thank you for your attention to this matter. Make America great again. So we're going to return to where we started here. And so the question is, how intelligent do you have to be to get into Congress and to run a campaign, to be successful, to be widely known and respected, to be a professional lawyer, to have credentials from multiple universities? How intelligent do you have to be? Rather intelligent. Listening to these two individuals talk, regardless of my own political bias, I hear coherent speech. Somebody I might be able to have a conversation with. I don't hear the muddled thought, the meandering, mean-spirited words that come out of Trump's mouth, coming out of these people's mouths. And so when it comes to IQ, I mean, I've not seen their IQ. I don't think Trump has either. But again, it's just an indication that he's mean, that he has an especially deep hate on for women and women of color, as you can see on the screen. And he hates competition. He hates the truth, apparently. So, allegedly. And so what we're going to do is just watch and wait. For now, until the next time, I felt it was worthwhile to have a bit of a comparison between a MoCA and an actual intelligence test. And perhaps, if he's good to his word, we'll see him on stage taking the WAIS at some point. I'm sure Jimmy Kimmel will be happy about that. All the best to you. Good luck. We'll talk again.